majority of the calories are coming from fat, not only gives you optimum health, but it allows you to defend yourself against environmental toxins and contaminants. If we look into chemistry, there are many what we call toxic footprints. There are many markers in a person's blood chemistry which indicate what the toxin is and where it's actually damaging. And I'm going to show up two which are very significant. And one is beta-2 microglobulin in the serum, and you'll hear about this shortly. And the other is an elevated porphyrin level. Let's have a look at porphyrins. Porphyrins are a chemical molecule that eventually goes on through the correct cleavage of those appendages to form heme. Heme is absolutely crucial. It's crucial in forming energy, ATP, carrying oxygen in the form of hemoglobin, and detoxification, cytochrome P450 system. Has anyone heard of that? It's called the liver detox system. What happens when you get exposed to environmental toxins, particularly heavy metals, and mercury is the most pervasive of all of the heavy metals. As a matter of fact, when they develop high fructose corn syrup, to extract that high fructose corn syrup, they use a process from the chloralkali plants, and that fructose gets contaminated with what? Mercury. So there are mercury levels in significant amounts, because there is no safe level, in most processed foods that have high fructose corn syrup. What age group do most of these people consume these high fructose consume? In our children. So, if we look at porphyrin metabolism, what the laboratories will do is when the porphyrin levels in the urine exceed 300, they will then split to work out which porphyrin is spilling in the urine. So to give you an example, if copper porphyrin and pre-copper porphyrin is showing up, then you know for sure that mercury and possibly lead is the poison that's causing the disturbance in porphyrin metabolism. The next major marker that we look at when we look into chemistry is we look at beta-2 microglobulin. And this is a marker that allows us to assess whether the toxin has hit the headquarters. It was first isolated and demonstrated in Minamata Bay disease. That's where, in Japan, in Minamata Bay, there was a lot of poisoning, purely due to mercury from the chloralkali plant upstream that was letting the refuse back into the bay, and people were consuming the fish. Resulted in a lot of neurological problems, significant, besides death. The people that were worst hit were obviously the young and the old. So methyl mercury exposure occurs from eating contaminated fish. Now, the sad thing is that all fish has methyl mercury in it. I'll just pass it. Okay. So who are the people, and how can we identify who the person is that's going to be most reactive? Who is the individual that when you get exposed to some toxin, who are they that are going to react and become quite unwell? So when we look into chemistry, we'll look at these markers. You'll usually find a person with a cholesterol level which is low. It's a low total cholesterol. They'll get fleeting thoughts of suicide, a whole range of neurological problems, numbness, tingling. The person with a poor protein status and the person with a poor iron status. So, it's no wonder that some adults seem a little strange, because when we get exposed to mercury, we get an enormous amount of mood, mind, and memory problems. A significant thing is when we get exposed to a toxin, how does the body deal with that toxin? Well, the majority of toxins, whether they're drugs, solvents, petrochemicals, pesticides, microbial toxins, even oxidized cholesterol and oxidized fatty acids, they're converted from being a fat-soluble toxin into a water-soluble toxin, and then excreted out through the gut, which is your greatest excretion organ, then the kidneys, and also sweat and breath. This system is known as what we call the cytochrome P450 system, and it's iron dependent. How do we upregulate that system? In other words, what type of dietary principles would actually make you more effective at dealing with these fat-soluble toxins? Well, we know that an ultra-high fat diet, or ketone-induced, or one that actually creates what we call a nutritional ketosis, which is measurable. And this is the problem with our program. There's no escape clause, because we take a measurement, the person follows the advice or doesn't follow the advice, we retest. Now, if I tell a person to do something and they absolutely do it 100%, and I come back and I retest, and the number hasn't changed, what I've told them to do is wrong. But on the same token, if they don't do it, the number doesn't change, then they're not doing it. So, upregulation of cytochrome P450 system requires an ultra-high fat diet. Now that is a medical term. To us, this isn't ultra-high fat. We're simply creating nutritional ketosis, which is measurable. A high protein diet, or a diet that is adequate in protein for your needs. So in other words, if your requirements are greater, you have to increase your protein requirements. How do we assess what's determined as being ideal? Well, we look into chemistry. Now, how do we down-regulate that cytochrome system? How do we make it more difficult to detoxify not only heavy metals, but fat-soluble toxins? Pesticides, PCBs, petrochemicals, solvents such as alcohol. Well, have a high carbohydrate diet. That'll do it. That's been confirmed in hospital settings when they give dextrose. Hospitalised people are often given intravenous infusions of these simple carbohydrates, which greatly depresses the cytochrome P450 system. People who receive these agents have most difficulty in ridding their body of xenobiotic agents. So a high carbohydrate, low fat diet results in poor detoxification capacity.